these pelvic health issues are common, but they're not normal. And so if you are brave enough to talk about them, you're going to find more and more people dealing with them. And unfortunately, a lot of our medical community still normalizes it. And it's like, no, it's not a normal thing. It's a common thing. And there are things you can do to prevent it from happening or to recover from it.
Hey, Mama, when was the last time anyone actually explained your pelvic floor to you? Not just told you to do your Kegels or sent you on your way, but really explained what's happening down there and what you can do about it. Because here's what I know as a labor and delivery nurse, the pelvic floor is one of the most overlooked, most misunderstood, but also one of the most important parts of your stinking body for your entire birth and postpartum experience. And most women don't find that out until something goes wrong. Today, I'm sitting down with Dr. Brooke Kalisiak, a pelvic physical therapist and the owner of Legacy Physical Therapy in St. Louis. She has been helping women prepare for birth, recovery, postpartum, and overcome issues like pelvic pain and bladder leakage for over 20 years. And she is on a full-on mission to change the conversation about what's normal, what's common, and what is not normal. This episode is packed with things your OB probably hasn't told you, but you deserve to know it. So grab your tea, settle in, and let's get into it. Hello, Brooke. Thank you so much for being here today.
Thank you for having me. I'm excited.
So Brooke and I met in St. Louis. We were both talking on a panel for Babies and Bumps, and you guys, her vibe is so like mine. And it was, although I got in a little bit of trouble, we can talk about that later, but I got a little slap on the hand. But so she said vagina quite a few times, and y'all know that is like my thing. I'll tell you a funny story about that too in a second, Brooke. But nice. I love when we don't like make it all jargony and it's too much. Like, let's just talk real, right?
Yeah. It just makes it easier. It's just another part of our body. And, it's so important in the birth and postpartum world. Like you just got to lay it out there and take away some of the mystery of it.
Yeah. It's so funny because my youngest son, so I have 7 kids, but my youngest son, he is so comfortable with the word vagina, but it's almost so much so like we were in Rome and we went to the Colosseum, and just randomly he tells the tour guide, who mind you was like late 20s tops. He goes, "My mom is obsessed with vaginas." And I was like, let me clarify a little here.
There's some levels to that. Okay.
Yeah. I'm like, let's get clear right now. Anyway, so we're going to be talking about vaginas, people. And we're going to be talking about pushing and just picking Brooke's brain. And I'm going to let you just tell everyone a little bit about you and why you started specializing in what you specialize. And you can let them know what you specialize in.
Sounds good. Well, my name is Dr. Brooke Kalisiak. I am a pelvic physical therapist in St. Louis, Missouri, and owner of Legacy Physical Therapy. And we are a clinic that specializes in pelvic health issues. So we work a lot with pregnant and postpartum moms who are both dealing with pelvic floor issues and trying to avoid pelvic floor issues. So we love the proactive person who's trying to make sure that they're optimizing their body for labor and delivery and that recovery afterwards. But yeah, I've been in the field for 20 years and just really enjoy working with these pelvic health conditions. And so, like I said, the vast majority of our population that we work with are women dealing with some type of pelvic floor issue, but everyone has a pelvis. So we have both male and female patients at our practice, but I have a special place in my heart for that pregnant and postpartum population.
Yeah. Well, Brooke, we don't talk about penises around here. Like that is not our jam. It's only vaginas on the birth experience. However, I've been doing this. So it's funny because my daughter is about to turn 21 and she is literally my physical representation of my labor and delivery career.
Nice.
About to be, yes. So I'm excited. So like what I would love to talk about, and I think even for me as a labor and delivery nurse for a very long time, until I started like educating myself outside of what the hospital provided, I really thought that you like had to tense up and use your pelvic floor to push the baby out. And I think that's one of the biggest misconceptions. So I'd love to dive in right there.
Yeah, very much so. The pelvic floor muscles are that bowl of muscles on the bottom. So think about it. If we tense them up, they contract and lift up into us and close off around the holes. They're what we use when we're learning to potty train. So they close off the holes. So we don't want to be contracting them when we're trying to push a baby out. Those pelvic floor muscles need to elongate and relax and stretch out. And it's the uterus in our body that does the work to push the baby out. It is not our pelvic floor muscles. But I think, like we kind of said earlier, like there's a mystery around this area. A lot of people don't have any awareness of what's going on in that area. And so then they're in labor and they're told to push and they don't know what to do. They're just like, okay, well, I'm not sure what to do here. So I'm going to squeeze and I'm going to push. And we just end up with this, like, I call it pushing against a closed door. It's like, it doesn't feel like anything's going anywhere because you're fighting yourself with it. So
yeah, I say the same thing all the time. And I've done like a video before of like having someone coming through the door and like someone else actively pushing the door on them. And
very
it does not make for a very good entry at all.
No, a lot bigger chance for injury there. So
yeah. And it's so funny because as you were talking, my very first child was a long time ago. He's 36 now. And I remember my nurse saying to me, push down and out, down and out. And I'm like, what the hell does down and out mean? Yeah. But I feel like now that there's so much education about the pelvic floor, in your mind, it makes it logically make sense what you're doing. So I would love for you to like walk through, if you had a patient that's sitting here who comes to you and she's like, Brooke, I'm scared to death of pushing. I'm scared of tearing, because we all know that's like the number one fear that they all have. Like, let's walk through the listeners, like they're sitting there with you and like give us some like practical steps and tips and Brooke wisdom.
Yeah. So, I mean, that's the beauty of what we do here in pelvic physical therapy, is giving people the opportunity to practice that ahead of time. So if you're here in person, we practice that in many different positions to figure out what is your best position that you can create that push. So, some people are surprised to realize, like, man, I can push really well when I'm on my side or when I'm on all fours and that. So we get to practice that with that feedback from the therapist on what exactly is happening in that situation. But if you're new to trying to experience what pushing feels like, an example I love to give people is belly big, belly hard, which at the end of your pregnancy, it really feels that way. But thinking like you swallowed a beach ball and you're trying to take that beach ball and push it down towards the pelvic floor area. And for some reason, for a lot of people, that visual of like, okay, I've got that and I've got to push that downward really helps them to kind of open up and get that correct kind of pushing position. And for others, it's really playing around with it in different positions. So I highly recommend not just practicing that in sitting or in laying down with your knees up or that, but trying laying on your side in a squat position, on your hands and knees, over a ball, because you might find like, oh, wow, like I really feel this push in this position, but I don't feel it as much in this one. And so it can kind of give you a list of like, cool, these are my good positions that I can feel it in. So
I love that. And I love the analogy of the beach ball, because if you're thinking about lowering it, you automatically, your brain kind of realizes that you have to open the door and like relax to push it down. So that makes a lot of sense. And I love that you mentioned practicing those positions. We teach our students that as well. We have a course that's only positions. That's all it is just all positions, whether it's pregnancy posture, late pregnancy for pain, or pushing with an epidural or without. And we tell them the same thing. We're like, create like the vibe. You don't want your toddler running around screaming and stuff. But what I feel like surprises a lot of women, and I get flack online for this as well, is that sometimes on their back, like for me, with all of my kids, I was unmedicated. I did all the positions, and with all of them at the very end, for the last few pushes, I found my power on my back, not straight on my back. Yeah. But I think that them getting comfortable with the positions and also letting go of any absolute, because you can't go into birth with any absolute.
Correct. Yeah.
Like I tell my students all the time, you can refuse everything, but should you? And whenever I talk about pushing on the back, I get so much flack from all the people like, it's not good. No, but if it works for you, then you can use it. So
Yeah.
so let's go back. So you said that your superpower is making pelvic health feel relatable and
Yeah.
comfortable to talk about. So what do you think the thing is that most women, when they come to you, are most embarrassed about?
Mhm.
Or like, what do you want them to know about that?
I'd say, I mean, the vast majority of our patients come to us with some type of bladder issue. That's probably the most common. So, some type of leakage, and it happens during pregnancy as well, but is
Mhm.
really common in that postpartum period because those pelvic floor muscles, especially if you delivered vaginally, went through a massive stretch.
Mhm.
And the nerves that supply them went through a stretch, and the bladder got pushed on as the baby went by. So, everything's a little bit off and needs time to recover. And sometimes it needs some help recovering. And I think as a society, I've been doing this for 2 decades now, and I've seen a change over time, and we're talking about it more. And there's more familiarity with pelvic physical therapy as an option for people, and people are being more proactive health wise as it relates to their pelvic health. But I still see so many women get told by their doctor, like, oh, yeah, you just had a baby. Leakage is going to be normal. Like, when it gets bad enough or after you're done having kids, come back and we'll do surgery. And it's like, okay, like I just got brave enough to tell you that I'm dealing with bladder leakage, and you just kind of write
Mhm.
me off with it. And so many people come into my office and they might be either very early postpartum or they might be years postpartum, and they're like, I know I probably waited too long. Is there anything that I can do about this right now? Like I didn't, I just thought I had to live with this, but then my friends said, "No, you need to try pelvic
Yeah.
physical therapy," and they try it out, and so letting people know that these issues. My tagline is that these pelvic health issues are common, but they're not normal, and so
Yeah.
if you are brave enough to talk about them, you're going to find more and more people dealing with them. And unfortunately, a lot of our medical community still normalizes it. And it's like, no, 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 it's not a normal thing. It's a common thing. And there are things you can do to prevent it from happening or to recover from it without having to just rely on diapers for yourself. Those are for your babies, not for you. So,
Yeah, and it's just maddening because we know a lot of these issues, if men were having them, they would not be waiting and trying to figure it out. Like they
mhm,
would be actively figuring it out
yeah,
right now.
yeah.
So, with that, and these women, you mentioned something about them waiting and then them coming because they've heard from someone else. Is there, like, in your mind, like a too soon or too late in this? Like, too soon to see you or too late to see you?
No, no, it's never too soon. It's never too late. As far as early postpartum recovery, when we work with someone during their pregnancy, we check in with them a couple weeks after they deliver and do a virtual check-in appointment to make sure things are going all right. If everyone's had a fairly normal birth experience and they're feeling really good from it, we really do try and value the rest and recover aspect afterward.
Yeah.
I mean, there's definitely some gentle things that people can be doing at home to kind of support the recovery there, but I don't need them getting out and about with their baby for a special appointment to see me. So we usually wait until about the 6 week point to see someone in person and evaluate what are your pelvic floor muscles doing? What are your abdominal muscles doing? Do you have an abdominal separation? So all of these different things that can happen with pregnancy and that postpartum recovery, we're kind of making sure everything's moving back in the right direction and working the way that it should be and coordinating together well. But that being said, I've seen someone as early as a week after delivery because they're having pain issues. So they
Mhm.
can't sit comfortably because something's off down there. Their back or their hips or their tailbone or their pelvic floor or their lower abdominal area is just bugging them, and they can't take care of their baby the way that they want to. And in that situation, it's like, come on in, let's help you out as much as possible so that you can get back to taking care of your baby right away. And on the flip side, our body's amazing. It is never too late to make a change. I think our oldest patient here was 93 years old. So talk about
Wow.
postpartum, like
Yeah.
way, but like it's never too late to make a change. And that's the beauty of the human body, is that we can teach it new things, and our body can react different ways. So a lot of women, we've found it's pretty common that once their kiddos hit school age, they hit kindergarten or even preschool, they're suddenly like, hey, I actually have a little bit more time. Like I can do
Yeah.
something about this now. I'm going to come in now. So we tend to see a lot of women who wait until their kids hit that school age and then come and see us too.
Which is literally just how it is, because time flies and you're so busy and you're taking care of these kids and like you don't think about yourself at all. Or
Mhm.
if you do, it's like right when you go to bed and you're like, oh, I need to do that. And then the next day takes over.
Yeah, pretty
That's
much.
so, one thing you said is you said at 1 week they're like having pain and they're not able to sit. But don't you think like a lot of women would be confused on that one? Like, how would she know this is something I need to have checked out? Because I know I had stitches
Oh
with
yeah.
some hemorrhoids,
Yeah. Oh yeah.
you
Yeah.
know.
No, I'd say in that situation, that's probably someone that we've worked with during their pregnancy and they've maybe already had some issues. So, pretty common pain issues
Mm,
that happen during pregnancy are sciatica or SI joint dysfunction or low back pain. And so, in that situation, a lot of times we'll get that phone call from someone that, like, that same pain that I had that we were working on, it's back and it's really bad right now. So I'm glad you asked the clarifying question because, yeah, you are going to have some pain and
yeah.
discomfort from delivery. It is not all peaches and roses. So let's be real here.
No.
But it definitely, it's more of a situation where like an existing pain condition is coming back with a vengeance and it's preventing
Okay.
them from doing things that they want to be able to do.
Okay, so that makes sense. So now I would love to talk about what are some things that you recommend that pregnant women actually should be doing or not doing, to protect her pelvic floor, to protect,
Yeah.
her body.
Yeah. So something that's wonderful to get started during pregnancy because it is something that you can carry over in the very early postpartum phase to help the muscles is what I call core connection breathing. So our diaphragm, our belly, and our pelvic floor muscles all work together to regulate pressure in our abdominal area. And so if we can start getting used to coordinating together those systems while we're pregnant, we can then, right after we have the baby, start that back up again. And so when you're pregnant, I say sometimes it's a little bit easier because you have the baby in there. It does stretch
Yeah.
out a little bit, but I tell them to hug their baby with their belly. So inhale and relax, exhale and try and hug their baby with their belly, pull in around it and hold for a few seconds and then let it go. Okay. And getting used to what that feels like and that ability to kind of pull the abdominal muscles in gently around the baby and thinking about it all the way down into the pelvic floor. Because when we hug our baby with the belly, we should also feel the pelvic floor kind of lift up and in a little bit as well. So practicing that movement, honestly, like 5 to 10 reps once or twice a day. It's not something you don't need to walk around all day holding everything tight. Definitely.
Yeah.
But, just practicing that and getting it used to it because that's something in like a day or two postpartum, you can start doing that again to try and reactivate the abdominal core, diaphragm and pelvic floor muscles kind of coordinating together. So that's like the earliest exercise that you can get back to and kind of get that connection going again.
Well, and that's also a great breathing technique for mindset and
Mm-hmm.
fear and
Yeah.
anxiety.
Mm-hmm. It really
It's
is.
so crazy how powerful just breathing
Yeah.
is. That's one of the things that we teach. I did Lamaze for my first birth. It was a hospital Lamaze class. I ended up on oxygen. I was hyperventilating. And people are always like, what are some breathing techniques? And literally we show them almost basically the same as what you said, just a little bit different. And
Yeah.
it's one breathing technique. And then we teach them the candle, like panting during
Yeah. Yeah.
the ring of fire. But I think people overcomplicate breathing and they underestimate the power
Yeah.
of breathing techniques,
Yeah. And I
you know?
think it can be really hard for a lot of women, especially if you grew up as an ab gripper. You were like your mom always told you stand up straight and pull it in.
Yeah.
And so you're used to pulling everything in and not letting that belly move.
Yeah.
It if that's the case, in order to get a deep breath, the only way you can do it is to go up into your upper chest and shoulders. And so if that's a habit that you've had in place for heck, it could be decades, and
Yeah.
that depending on when your pregnancy comes. And then you're pregnant and baby's sitting up there pushing up on your lungs and, giving you no room that way. So
Yeah.
again, the only time you can get a deep breath is to breathe up into your shoulders. What seems like a simple breathing pattern as we talk about it right now can feel completely foreign. And they're like,
Yeah.
oh yeah, no, I broke. That's why I always make people practice their breathing and their exercises when they come back to see me. Cause like, I want to say like 8 to 9 times out of 10, someone will come back. I've been doing my deep breathing. I'll be like, okay, cool. Show me. And they're like,
Yeah.
and I was like, no, that wasn't quite what we were doing. So
Yeah.
it's something that for a lot of people, they have to really change that pattern and practice it. And it can feel very mentally challenging to kind of do.
Yeah. Well, and I did breath work at an event recently. They had a breath work person,
Mm-hmm.
and it definitely can be like almost intimidating when you first start to try to figure it out. And you're like, what the heck am I doing wrong?
Mm-hmm.
But it's also, once you get it, you get it.
Yeah, very much.
So for you guys listening, like I love this because you demonstrated this at Babies and Bumps for the ladies. I do remember that. And I feel like when you're pregnant, you feel like you're out of control. And that's a way for you to a simple, like, we're not asking you to go like walk for 45 minutes and lift some weights and do some squats. Although you guys know, I want you doing some like deep sitting squats, but it's a really simple way for them to like have some control in this, because everything feels so out of control. Okay, so we've been talking about pregnant women. Can you walk me through a postpartum, like a patient who comes to you postpartum? Because I feel like it's a big mystery. I know some of my students, because we hang out with our students a lot on Zoom. We have pregnancy hangouts, and a lot of them are intimidated to come see you. And what the heck is she going to do? Like, what's she going to put inside me?
Yeah, no,
What are these things? So I feel like someone who has not, like, we tell all of our students to see a pelvic floor specialist for a baseline. And I wish I had done that. But I feel like what I see with my postpartum students that come to me later in pregnancy, they don't see a pelvic floor specialist. They have this like fear of the unknown to come see you because they've had a lot of trauma down yonder. So I'd love you to kind of like walk us through, what does a postpartum visit looks like?
I'm happy to do that, because you are right. The mystery of like, wait a minute, like, especially for some people who have, like the example I give is I had a patient who had to do physical therapy for like an ankle sprain recently. And so that's her visual of what physical therapy. And she's like, Brooke, you just like, I waited a while to see you because I just couldn't, like, I couldn't picture it. I mean, I was going to physical therapy for my ankle, and there were like 20 other people in the gym, and everyone's doing exercises, and I'm supposed to talk about my pelvic area. I was like, yeah, this is a little bit different here. And so pelvic physical therapy is one-on-one with your therapist, usually behind a closed, in a closed treatment room with no one else around except anyone, like any support people you would want to have there. It is extremely consent-based, where the therapist should be asking you or giving you information about what's going to happen and asking your permission very much so along the way.
Yes, please.
Yes, always asking permission. Sometimes my patients are like, really, Brooke, I give you global consent. I was like, that's great. I'm going to keep asking permission every time I touch a private area. But first, we do a lot of talking just to see what's going on with you, what symptoms you might be experiencing, what you've done that's helped, what's maybe causing problems, and getting a sense of what you hope to get out of your time here. And that, because that may be different than what I think might be important. So we want to make sure that we analyze that and make sure that we're addressing your goals. And then typically the evaluation will start with a posture assessment and looking at how you're breathing, checking to see if you have a diastasis, which is the separation of the abdominal muscles. And that's typically done in a laying down position to see how big that separation might be or if it's present at all. Then we're checking your abdominal muscle strength. If you've had a C-section, we're going to check your C-section scar to see how it's moving.
So how are you checking the abdominal strength?
We check abdominal strength with 2 or 3 different tests. So one is like a basic sit-up test.
Okay.
That's going to look at the rectus abdominis muscles, which are the six-pack muscles in the middle, to see how they do curling you up. The others is looking at the transverse abdominal muscles, which are the muscles that wrap in from the side and make a corset around us, and kind of there are pull-it-in muscles, and they get the most stretched out during pregnancy. So that's having you try and give yourself that hug. Like, that's why I tell people to practice it during pregnancy. Like, can you hug in around the baby? There's just no baby there now. And then we challenge that by moving your arms or legs different ways to see if you can keep holding that position. Or do you start to feel those tummy muscles push out or your back arch off the table or that? So that's how we assess how those
Which
muscles
is
are
another
performing.
reason why you probably wait till they're at least 6 weeks
Mhm.
postpartum.
Yeah, yeah, very
Because you are
much so.
not feeling all that when you're
No,
two
no,
weeks postpartum.
definitely
Yeah.
not. But again,
Okay.
getting a
So,
baseline where people are at with it.
yeah.
Also going to look at hip mobility by moving the legs around a few different ways to look at how mobile they are, and testing the strength of the buttocks muscles. That's often done on the side where we kind of lift the leg up and back and see if you can kind of hold that. And then to the patient's comfort level, we assess what's going on with the pelvic floor muscles. So typically that involves putting a sheet down on the table and one for the patient to cover up with. And then we step out for a moment and have them undress from the waist down and laying down on their back covered up with the sheet. There's no hidden stirrups here, nothing like that.
Yeah.
And no speculum is used. It is the gold standard for a pelvic floor assessment is a single finger insertion into the vaginal canal. And so with the patient's permission, we put some lubricant on one finger and insert the finger into the vaginal canal, first checking very superficially. So especially if they had any tearing or episiotomy in that area, we want to test the scar tissue mobility, and then sliding our finger in further to check the deeper layer of muscles, asking them to try and like think about squeezing around our finger or to try and contract like they're trying to hold back pee or gas to see if they can develop that muscle squeeze, but also checking for tense spots in the muscle. Just like, you might push up here on your shoulder and be like, oh, there's kind of a knot up there that doesn't feel so
Yeah.
hot. That tells me that, there might be a tense spot or a knot or trigger point in the pelvic floor muscles that might need to be dealt with so that it can function accordingly. That
And
part,
how do you deal with that?
just like you would up in the shoulder and the
That's
neck
what I was
area.
thinking.
Yeah, it
Okay.
just happens to
We're
be in a
getting down and dirty
area of
here
our
today,
body.
guys.
But so, yeah, we have various manual therapy or soft tissue techniques, which can involve putting deep pressure over the muscle or doing like a gentle stroking motion. It can be similar to like perineal massage if we're dealing with the
Okay.
scar tissue or that in the area. We're just working on the restrictions, and it might be something that we work on with them here in the clinic. It might be something that we're teaching them to do to themselves at home. I love to give postpartum moms tasks they can do it when they shower, because that seems to be their
Yeah.
only alone time. So,
Yeah.
being able to try and, fit it in that way. But ultimately, like, we come up with a plan based on that information of what are our problem areas and what do we potentially need to work on to accomplish their goals. And they go home at our place, they go home that day with things that they can work on right away to start feeling better, as well as things that we're going to be working on in the future and how often that we might be needing to get together to accomplish their goals.
If you're pregnant and feeling overwhelmed, unsure about what really matters for birth, or hoping it all just goes well, this is for you. Most parents don't realize that it isn't effort, it's preparation that actually builds confidence. The Calm Birth Bundle closes that gap. It walks you through labor, birth, and your options in a clear, calming way. So you're not guessing in the moment or relying on someone else to decide for you. The goal isn't a perfect birth. It's a confident one. Right now, as a podcast listener, you can take $50 off with the code POD50. Go to labornursemama.com/calm, CALM. Get prepared, feel grounded, and go into your birth knowing you've done your part. I love that. And I love like demystifying it, because it really is it's such a mystery, because even for me being in the online space since 2017, 2018 now, I feel like only in the last 3 or 4 years has this become like such a topic that, like, when I first started online, there wasn't a lot of people. There was a few, but I feel like now these women who are having babies now are so much like more educated. But even for me, like, I didn't know exactly all of what you do because I've never done it. So I love like just demystifying that, because the fear of the unknown is so real. And she's got a newborn. She's tired. She has no sleep. Her boobs are hurting. Her bottom's hurting. She's got all these things going on. But I just want to encourage you guys, if you're listening, I'm going to have you pipe in on this as well, is that taking care of this now when you're younger, you're just going to have an easier life. Like, as a woman, I think we put off our own self-care, and especially like my age, that just wasn't the thing. Like, you took care of your kids, like their needs, your partner's needs, and like we just were always on the back burner. So I really applaud the women who are doing this and taking control of their journey. And I would love to hear what you have to say about, like, if let's say they're having like, you said the urinary, right?
Mhm. Yeah.
Let's say they're leaking and
Yeah.
they're listening to their nanny and their Aunt Sally and everyone saying, oh, that's just what happens after you have a baby. Like, what are some repercussions down the road if they don't
Yeah. No,
deal with
that's a
this
great way
now?
to think about it. And so I'll take a step back from it where you had said originally that you think even if people are doing well, you recommend them getting in and getting a baseline. And that is so true because the human body has a lot of redundant systems to it. Like we're designed to survive. So
Yeah.
we can come out of, delivery into that postpartum period and actually be doing pretty well, not having any issues and thinking like, cool, I'm one of the lucky ones. This is
Yeah.
awesome. I'm bouncing back. Oh, great. But you may have some underlying pelvic floor dysfunction or weakness or coordination issues with the core muscles or separation of those abdominal muscles, just not enough that it's causing any symptoms at that time.
Yeah.
But what happens is down the road, when Mother Nature comes a calling again, especially that menopausal period where we take estrogen out of the picture, that is when I see a ton of women who didn't necessarily have issues early postpartum starting to have issues. And a lot of it can be traced back to, oh, you have an episiotomy scar that's not moving very well, or your C-section scar is not moving well. You never really rehabbed your abs and you have some funky movement patterns with your abs
Hmm.
that are putting pressure down. So again, our body figures out how to get it done, but it might not be the best way.
Yeah.
And that's where we can get into problems and that. And so I love the idea that everyone should come in at least for a baseline appointment to be evaluated. Now, don't get me wrong, in that situation, we have green lighted women who are doing great postpartum and being like, hey, you are doing really well. We don't necessarily have to worry. Here are some things to look out for in the future should you start to notice
Right.
stuff, but you're in a good place. And then there are others that we catch some stuff pretty early. They're not necessarily super symptomatic, but if they didn't change some patterns or they didn't do some
Yeah.
rehab work, they're going to start to be symptomatic. And then there's a
Hmm.
third group where it's like, oh, you are symptomatic right now. You are dealing with a lot of bladder leakage. You are dealing with painful intercourse, maybe just pelvic pressure, heaviness, discomfort. Like we want to take care of these now so that you don't have a problem further down the road.
Yeah, so I know I told you I like to keep the episodes to 30 minutes or so, but I just had a question that I want to ask you. What are some like and then we'll kind of close out and tell everybody where they can find you, but what are some like weird things that might be going on that someone is not relating to their pelvic floor? Cuz I think everyone knows painful sex, they know urinary leaking. What are some things that could be
Oh,
pelvic
yeah.
floor?
I mean, not necessarily weird symptoms, but you might not correlate that it's related to your pelvic floor. Sometimes your upper neck and shoulder and upper back pain, even low back pain, can actually be related to what's going on in your core and pelvic floor. So remember, this system got crazy stretched out and may not be working well. And so our body's like, what's the next closest thing I can use? So it might try and stabilize by using the shoulders and the neck because down below isn't doing its job well.
Yeah.
Or abdominal area might be really stretched out. So the back muscles are like, okay, I'm going to hold on for dear life and I'm going to do all
Yeah.
the work. And it's like, if no one's assessing that whole core canister, your diaphragm, your
Yeah.
abdominal muscles in your pelvic floor, that may be a huge contributor to why you're having continued back pain or shoulder or neck pain. And so we get that a lot where we've had people being like, oh yeah, I have this low back pain since I had my baby and I'm working with my
It was probably my
chiropractor.
epidural.
Yeah, it helps.
Yeah.
A massage helps, but it never makes it go away. My chiropractor helps, but it doesn't go away completely. It's like, well, yeah, we got to figure out what the other muscles are doing around there
Yeah.
to make sure everything's working well together. So that would be kind of, I guess, odd in that people wouldn't think about their neck and
Yeah.
shoulder pain potentially being related to
Yeah.
their core and pelvic floor not working well.
All right, mamas, you listening? I think the core truth that we have said throughout this is get a baseline during pregnancy and then a baseline in postpartum, even if you're doing well, because it's really hard. Like I was having a conversation with one of my adult sons yesterday who lives in Florida. He works out in the sun. And I'm like, are you wearing sunscreen? And he's like, yeah, sort of. And I'm like, listen, these things compound. Like when you're young, and you feel seemingly good, you don't think about those repercussions down the road. So we're saying, like, for you, like, listening, take care of you. You are like the cornerstone of this family. Like, you really are.
Yep.
And you need to be healthy, and you matter, and your body matters. So,
Yeah.
Dr. Brooke, we would love to, if you could share with everyone where they can find you. I don't know if you have a social media presence
Oh, yeah.
or,
I
okay,
I
so
love
share with us.
educating people on pelvic health issues and what they can do about it themselves. So yes, on socials, so Facebook, YouTube, Instagram, we are Legacy Physical Therapy STL. The STL is for St. Louis. We do lots of content educating on various pelvic health topics. And then our website is legacytherapystl.com. Again, we do a blog post a week on different topics. And we are very much on, like, what can people do to educate themselves to kind of get them moving in the right direction.
Yeah, because we all want the same thing. We want women to be healthy and to take care of their bodies and be empowered with knowledge. I always say this: knowledge is power if you use it.
Mm-hmm.
So take some of these tidbits today, ladies, and use it. Well, thank you so much for coming today.
I appreciate it. Thanks for having me.
All right, ladies, I hope that you enjoyed this conversation with Dr. Brooke and this episode of The Birth Experience with Labor Nurse Mama. And I have to say, that was enlightening for me. Like, I honestly did not know exactly what happens during that postpartum visit. So I'm glad we know. She's doing the work. She's breaking down the stigma, and she's making sure that you actually understand what's happening inside your beautiful body. And that is so powerful. So if this conversation opened your eyes, please share it with a friend, share it to your stories, tag me at labor.nurse.mama so that I can see it. And more importantly, so other moms find out that just because it's common, it's not normal. Every share is so important to us. Also, leave a review, please. Thank you. Such a huge favor, and it means so much to us. So if you're pregnant, you're postpartum, or you're dealing with any kind of pelvic floor stuff, reach out to Dr. Brooke. This is exactly what she's here for. And if you are in your third trimester or you're 6 weeks pregnant, you're here, and I'm so proud of you. Don't ever let anyone dismiss what you're feeling or rush your healing. As always, hit subscribe so you don't miss an episode. Share it with a friend who's pregnant. And if you have a minute, leave us a review. Again, it means the world to me, and it helps us reach more moms just like you. Our mission here at Labor Nurse Mama is to change the birth culture one birth at a time. I love you guys so much. And as always, I'll see you again next Friday. Bye for now.